Hello students, in this video we'll be discussing about antidepressant drugs. So what is basically the depression? Depression, by definition, it is a change in the mood. It is a change in the state of a mood which is pathological, which is characterized by low mood, low energy, loss of interest, loss of pleasure, and a change in appetite, the food habits, change in sleep, psychomotor retardation, even melancholia will be there, which is associated with suicidal thoughts. So it can either be occurring alone or it could be associated along with the phase of maniac, which we do call it as a bipolar disorder. So what are the theories of depression? So how does depression occurs? These are the amines. These are the amines which we call it as monoamines. So each of these is a monoamine: adrenaline, noradrenaline, dopamine, serotonin. So lack of these or failure of the presence of these in the synapse will cause depression, is what monoaminergic thesis of depression says. Whereas the neurotrophic hypothesis, which says that brain does need brain-derived neurotrophic factor, which is BDNF, or nerve growth factors, NGFs. So either the lack of these monoamines or lack of these BDNF. Always remember, BDNF and nerve growth factor are helpful for maintaining the nerve synapses, the way the nerves will get attached to each other. The new nerve formation, new nerve synapse formation, new nerve plasticity is maintained. So by treating the lack of monoamines, or by establishing synapses of the neurons, by replenishing BDNF and NGF, depression can be treated. So how will these antidepressant drugs work? So we have these four amines. These four amines should be saved, they should be maintained. These are the enzymes which are monoamine oxidases, which will break down these amines which are present above. These enzymes will break down the amines which are present above. So in that we have monoamine oxidase, which these are the names of the enzymes: monoamine oxidase, which are of two types. They have two isoenzymes, MAO-A and MAO-B. These are the monoamines which we are talking about. These enzymes will break down these monoamines. So if we try to block these enzymes from breaking down, the amine level will be retained in the synapse, so that the serotonin level will rise back to the normal levels, so that the depression will be gone. So that is a way of treating a depression. So how to remember this name? These are reversible inhibitors of MAO-A. These are the reversible inhibitors of MAO-A type. So we have moclobemide and chlorgelin. So here I have made a mnemonic: mouth closed. Here, mouth closed. Close the mouth of this enzyme so that the serotonin will not be broken again. This is the monoamine. It will not be broken. So remember this name as mouth closed bemide and chlorgelin, something like closing the mouth again. So MAO-A can be remembered in that way. So we do have MAO-B also. Here MAO-B inhibitors are selegiline and rasagiline. How to remember this name? So we have a mob over here, which is MAO-B. Remember this as MAO-B, which is a mob, which are selling armrests illegally. So we have to stop this. We have to stop MAO-B by using selegiline and rasagiline. These will be looking at in the Parkinsonism and other diseases, not in depression. For now, we have these drugs, moclobemide and chlorgelin, for depression. So next, there is something called as cheese reaction. Some people who will be sensitive, who will be taking the drugs which are MAO inhibitors, MAO monoamine oxidase inhibitors, the enzyme which we saw previously, these enzymes are locked. These enzymes' mouths are closed. They cannot metabolize anything. So if a person takes either cheese or beer or wine or pickled meat, fish or yeast extract, anything, they'll be having some components called as tyramine or dopamine. So if this tyramine is a person intakes all these things and there is no breakdown by MAO, it directly goes and acts on the adrenergic neurons. It is because tyramine is indirectly acting sympathomimetic. It will ultimately release noradrenaline in the body. So eating cheese is causing you increased amount of noradrenaline in the body, which will cause hypertensive crisis. This is called as cheese reaction. Eating cheese had given you hypertension. Remember this. Because the enzymes are blocked or locked, the mouth is closed in the body for the people who are taking those drugs alone. And we have tricyclic antidepressants. We have examples: imipramine, trimipramine, clomipramine. Always these are lovely. So prame, they'll give prame. For the trips, they'll be going to trips and they'll be loving doxepin and dothepin. So how do these act? So in the synapse, these are the reverse, whatever the neurotransmitters are released into the synapse, norepinephrine transporter or serotonin transporter will bring them back into the presynaptic terminal. So these drugs act by blocking the reuptake of norepinephrine and reuptake of serotonin from the synapse. Therefore, the amount of norepinephrine will increase, the amount of serotonin will increase in the synapse. This is how the tricyclic antidepressants will work. So what are the side effects? These drugs has a typical side effect which can be remembered by the name ACH. These are adrenergic, cholinergic and histaminergic. So these will have anti-adrenergic side effects, anticholinergic, antihistaminic side effects. Remember this. Because of these heavy humongous side effects, these were replaced by now newer drugs which are known as SSRIs, SNRIs and atypical antidepressant. So these are if you remember the anticholinergic side effects: dry mouth, constipation, urinary retention. Sweating is paradoxical, but yeah, it will happen. Increased appetite, weight gain will happen, seizure threshold will be reduced. Anti-adrenergic features like postural hypotension will occur because of using tricyclic antidepressants. So these were replaced by the new drugs which are known as selective serotonin reuptake inhibitors. Selective serotonin reuptake inhibitors will inhibit the reuptake of serotonin alone. They won't be acting on noradrenaline or norepinephrine. So these will act and they will not have the adverse effects which we saw previously. ACH, anti-adrenergic, anticholinergic, antihistaminergic effects will not be there in SSRIs, and they are now currently being used very widely for the treatment of depression. Along with that, these drugs are also useful for treating anxiety, phobias, panic attacks, post-traumatic stress disorder and OCD. How to remember this? Just take any four of your friends or four of your classmates. They'll have either of these, or they will look that, I don't mean to say that they'll have this, but you can remember in such a way that one of these persons will have definitely one of these kind of character which they'll be exhibiting. So remember according to their names. Side effects, in spite of not having those prominent side effects, these are minor side effects, because when the serotonin levels are increased, because we are increasing the serotonin in the synapse, it happens throughout the body. So 5-HT3 receptors are prone to get stimulated and they'll cause vomiting. And 5-HT4 they'll be sensitive and they'll be causing diarrhea or loose motions. So vomiting and diarrhea are because of stimulation of 5-HT3 and 5-HT4 by the excessive serotonin which are released by SSRIs. We have the names fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, escitalopram, dapagliflozin. So they have these PTSDs, OCD, premenstrual dysphoric disorder. These are the uses, and dapagliflozin is also useful for delaying the premature ejaculation. So how to remember these names? These names are new, and we how to remember these? I made this mnemonic saying that flu parrots, damp secretions, cities, which is flu will be spread by damp secretions of parrots in the cities. Imagine that parrots are the reason behind spreading of flu. This is not a fact, but remember like this as a mnemonic: flu for fluoxetine, parrot for paroxetine, damp for dapagliflozin, secretions for sertraline, cities for citalopram, and extra is escitalopram. So remember the names based on this mnemonic. So then we have a serotonin syndrome, which carries us to SSRIs for increasing serotonin in the synapse. Other drugs, MAOs, the first class of drugs which we are learning, will increase serotonin in the synapse. Tramadol, if you learn the mechanism, it will increase serotonin in the synapse. Pethidine will increase serotonin. So serotonin plus serotonin will give more serotonin, which is called a serotonin syndrome. So what will happen? There will be restlessness, hyperthermia, sweating, rigidity, delirium and twitching. So never ever combine these two drug combinations is what I want to let you know. Then we do have serotonin noradrenaline reuptake inhibitors, which are known as SNRIs. These also do not have the adverse effects like that of tricyclic antidepressants. How to remember these names? There are three names in this: venlafaxine, desvenlafaxine, duloxetine. So her name is Vanilla. She lives in a duplex home. She came home back from foreign. But still she is depressed because she is missing her country, which is for the foreign country. So Vanilla in duplex home is still depressed because she's an NRI. She's an RI, which means SNRI. She's an RI. So when she came back, she is vanilla, which is vanilla flaxin. Duplex is duloxetine. Vanilla and duloxetine. Remember with this mnemonic. Fine. Then we have atypical antidepressants, which will not have the classical way of curing depression as we have seen before. These will have a newer way of treating depression. The first one among this class is Trazodone. There is a tragedy which had happened. So one of the doors is blocked. We have first door, which is 5-HT1. The second door is 5-HT2. This door is blocked by this drug, which is Trazodone, because some tragedy had happened, which you can see here. And only the serotonin which is being produced will go only through 5-HT1, which will be having antidepressant action. So 5-HTs are all the receptors, 5-HT1, 5-HT2, 3, 4, like that. 3 and 4 in the GIT, 1 and 2 will be in the CNS and other places. So we are blocking this because the whole of the serotonin which we are getting will only and only go through the receptor which we need. 5-HT1 will have antidepressant property, so we are blocking all other doors so that only the antidepressant action will be depicted by the serotonin which we are getting. Then we have the other drug, which is Mianserin. Her name is Mia and her name is Serin. They both are traveling in the car. Accidentally, the water bottle which they are drinking came under the brakes. This came under the brake so that she can't press the brake pedal anymore. So the car will not be stopped, then the car will be ultimately losing the control. Similarly, we have alpha-2 receptors which are present on the presynaptic neuron, which are called as the brakes. If these brakes are blocked, if these brakes are not there, if these brakes are blocked, nobody to stop it. So excessive amounts of noradrenaline, serotonin will be released. So depression can be cured with the help of these. So breaking the brakes, which means blocking the brakes, is giving us excessive amount of noradrenaline and serotonin. This is how Mianserin, the drug name is Mianserin, will act. This is how I just wanted to make it easier to remember. Then we have Mirtazapine. This is just a combination of both. By blocking the other doors, your serotonin will go through only 5-HT1 door, so that only antidepressant action will be there. And also it also acts by this way. It is blocking the brakes, so that alpha-2 is blocked. Alpha-2 is blocked and noradrenaline will be going all together, and serotonin is being allowed only. Serotonin is allowed only through 5-HT1 receptor. So selective 5-HT1 and noradrenaline. So therefore these are called as selective, specific serotonergic antidepressant, noradrenergic, and specific serotonergic antidepressant, which we call it as NASSA. So this is a combination of the two mechanisms which we have learnt about. Mirtazapine. Bupropion. Remember, it has ropion. Bup is something like bees. Just remember like that. Bup is like bees rupai. Bees rupai will get cigarette. So bupropion is mainly used for smoking cessation, because this bupropion will prevent the reuptake of norepinephrine or noradrenaline and dopamine, NADA or DANA. Both these neurotransmitters, the four chubby, cute neurotransmitters which we saw in the beginning, will be prevented from reuptake, so that their amount will increase. Once the dopamine will increase in the synapse, the person will feel like he is already happy, he got a gift, so that he won't be smoking that day again. So this will act by increasing the dopamine level, so he won't be feeling like smoking again. So it's also useful for smoking cessation. And we have something called as amoxapine, amineptin. So just remember AMO and AMI, but they do have antidepressant property. This is only the paradox. So once if you start giving the drugs, they will not stop. They will not be acting immediately, but they will take time for 2 to 3 weeks. Why? Because once if you start giving these reuptake inhibitors, these drugs which are coming out, these are the neurotransmitters, noradrenaline, serotonin, they'll first go and bind on the autoreceptors which are present on the presynaptic neuron. They'll not act here. No, they'll not act here. They'll go and act on the presynaptic neurons, alpha-2 and 5-HT1. Therefore, there will be temporary cessation of all the neurotransmitter release for a few weeks. Later, due to excessive action over here, these receptors, if you see, they are desensitized. So after that, there will be a huge rainfall of these neurotransmitters. From then, there will be free flow of the neurotransmitters, norepinephrine and serotonin, so that the antidepressant effect comes from that day. Thank you everyone. Thank you for your time and hope you enjoyed the video.